Hi, I'm Dr. Shane Howell with Alternative Health Management, and I'm going to demonstrate a pelvic mobilization process that I recommend with my patients. It's really easy to do. It needs very little equipment, and a lot of times you can do some of the things in bed. So if you're have a lot of stiffness or just want to get mobile before you get ready for your day. So first thing I want to just kind of show you what the spine, what area we're looking at. So this is kind of a smaller version of the spine. Here's your low back, it's called your lumbar spine. This is your sacrum, and this is your pelvis on each side. And then in between is called your sacroiliac joints. So that's real important to keep those mobile. So this process will help with things like sciatica, low back pain, hip pain, any kind of stiffness or restriction in those areas. And so it's real important because this is a foundation of our spinal system and how we move. So it's something I do myself. So it's very easy. Now I'm going to use a little ball, but you can use like a little pillow or something like that. It's essentially going to get kind of in a, like you're going to do a sit-up. You're just going to put the ball or the pillow between your legs, slide back, then you're going to squeeze nice and firm together. And once you get that, you just kind of gently go back and forth. And I'm going to count to 20. So 1, 2, and go to 20. Okay? Then I take that out, kind of sit up. And usually I'll use something like a little small resistance loop that you're going to put around your ankles and then move it up to around your knees. Okay? And this one you're going to push out. So it's the opposite of the one we just did. So as you're holding that, do the same thing. Count to 20. Okay? So 20. And then after I'm done with that, as I'm still kind of pushing out a little bit, I'm going to lift my pelvis. And I'm going to hold it. And I count to about 10. If you can hold it to 20, that's even better. Just make sure you're nice and straight here, so you're not like overdoing it. Just hold it. Make sure you breathe. Okay? Then you take that out. The next thing you're gonna need that works is this is just a basic like broom or mop pole. So it's still kind of in the same position. And what you're gonna do is put it on the back side of the knee on one side and the front side of the other one. So I'll move just to get a little better view. And what you're gonna do is I'm gonna push my leg that way and pull towards me. I'm gonna hold it nice and firm for 5 seconds and relax. And I usually do it anywhere from, I repeat that anywhere from 3 to 5 times. Then I'll reverse, okay, and do the same thing. So it's doing a push and pull at the same time, okay? Then what I like to do, stand up. You can use the pole or I can use the wall. I'll just use the pole, and what I'll do is just gently go back, maintain good posture, forward and back with my leg. Not too far. I don't want to get any kind of weird extension in there. And I'll do that about 10 times. And then I'll do the reverse. Then I'll go side to side. Side to side, about 10 times. And then I'm going to rotate. If you need to go down at each time, that's fine too. Same thing, 10 times. Obviously I'm not doing 10 times, but I'm just for demonstration purposes. So that's something I do to help really mobilize this area, because if this area is not moving well, it starts to put a lot of stress on your lumbar spine, your hips, your knees, your feet. Just kind of works its way throughout the body. Okay, if you have any questions, just give us a call at Alternative Health Management at 713-722-2580.